from the property. We got a call from the property manager saying, one of the people that lives in this building is not one of your clients. She stopped eating 3 weeks ago. She is in a terrible state, and we just don't know what to do for her. So we had to get her consent to support her, but we went in immediately. We made sure she had meals. We made sure she was bathed. We made sure we were watching her day and night to try and get her back to her strength. So those are the kinds of things. Now we didn't do an intake with her yet. We've done it now. But like what I'm saying is that our job is to be there when people need us. And I wanted to invite you to share some similar supports and services where you live, because you may be aware of programs and services that we don't do here. And it would be very nice for you to share those with each other. Next slide. So why are we around? What is our purpose? Our whole purpose is to help people, seniors and adults with disabilities, remain well and living independently in their homes and community. Very few people want to go to long-term care. Most people don't want to go to emergency every other week. Our job, and people come to us for our exercise programs at 55, and sometimes they're with us for 40 years. Our job is to watch those people, continue doing assessments, figure out what their needs are changing, etc. So if we can get somebody in there to do respite care because they need it, whatever, we need to make sure that we're following their progress so that we can make sure that the programs that they need and services are there. Typically, community sports services are offered by nonprofits. There are private providers out there. They're quite expensive. We're not for profit, and we're not allowed to make a profit. If we do, we get in big trouble with our auditors. So we're not allowed to make a profit. We want to just use our money effectively to reach as many as possible. As I was saying earlier, we're not well understood in the community. Last week or the week before, I gave a presentation to a group of primary care physicians in one of the Ontario health teams. These guys work every day with patients. They knew nothing about us. And that's not their fault. We work in silos. They look after patients. They see them once every 3 months. The trick is we can go into those patients' homes and in real time see what's going on and report to the doctors. And that to me is a connection that is absolutely essential. But what surprised me was like watching a door open when we said, if your patient needs dialysis and needs transportation, we do that. If they need chemotherapy, they need transportation, we do that. If they can't get to the grocery store and they need groceries, we do that. So it was like a whole new set of supports that they weren't aware of. And I blame us. We are so busy doing what we do. We forget to lift our heads and say, we're out here. How can we help you? So this is why I really appreciate the opportunity to speak to you, because maybe you can spread the word and help people understand what may be available to them before things get really bad. We typically operate outside the healthcare system. It's not my desire. My desire would be is our acute and primary care providers, they should have us in their back pocket. As soon as they see a client that needs something, we want to be in their back pocket. This lady needs to be seen, needs to be helped. It hasn't happened yet, but I am very, very excited. I think it is going to happen. And I'll give you an example a little bit later of how it is happening around palliative care. We have a huge potential to help the healthcare system just because of where we are, because we go in and see these people every day. We know how they're doing. We watch their progress, etc. So we could be doing so much more as early warning to help their primary and acute care system get information that they need from us. And I can say one thing for sure about nonprofits, especially community support services agencies. None of us have any tolerance for competition. There's more people who need help than could possibly be helped. We have to work together. So if you called us and say, I want transportation, and I find out that you're in Scarborough, I would say, our intake would say, we don't provide transportation in Scarborough, but here's who does. And do the warm handoff so that you know you're not trying to face the phone book and say, well, where the heck do I start with this? So we do help people navigate the system. Absolutely. If we can't do it, we'll find someone who can. And so that's our philosophy. Next page, please. So I'm just going to do a quick overview of the kinds of services we provide, and I will be going into more detail on these services because some of this may not make a lot of sense. Our jargon is probably different than other people's jargon. We have our own though. So we run adult day programs primarily for people with dementia and Alzheimer's or adults with disabilities. We also go into various seniors apartment buildings, like the one I mentioned with the woman who was just so sick and had no help. We do assisted living in those apartment buildings, and based on the intake and assessment, we figure out what they need. Do they need help showering? Do they need help getting a sandwich? What do they need? We provide support for caregivers. The unsung heroes of our community are those that are looking after their loved ones, very often alone, very often isolated, and they get tired and they need to talk to each other and get support from each other, from others who really get it, who are in the same boat. We run an unusual program. I won't go into the details. It's called Hearts. We're very excited about it. It's absolutely new. As far as I know, there's nothing like it elsewhere in Canada. So I'll talk to you about that. We do health and wellness programs. Currently, we have 21 exercise and fitness classes. So we are at max capacity for our kinesiologists. They go all over the place. And the waiting list for these exercise classes is quite long. But don't despair. If you want to get in an exercise and fitness class, I'm desperately trying to find some more money to open more exercise and fitness classes where people are close to so they can get to it. We have something called friendly visiting and telephone reassurance. This is primarily done by our volunteers. We match a volunteer with someone we know is isolated and alone, and we just say, please contact them once a week, twice a week. Just check in. How are you doing? How's your fridge? Do you have enough food? Have you talked to your daughter lately? How are things going with you? And it's that one call that makes all the difference. Somebody knows you're out there. And if they don't get an answer, our volunteers immediately tell us. If they don't get an answer for the person they're trying to call, they call us and we go into action. We go and see how they're doing personally to check on them. We run what we call respite services. And what respite really means is it's support for caregivers. So, as you are, a friend of mine looked after all four of her parents and her in-laws and saw them all pass. And she was the only one doing this respite. And I know she carried quite a load. So she didn't know we did respite care. So for her, we could have helped her by, bringing in supports, giving her a day or two just to go to the dentist or maybe get her hair done. My heck, why not? Those are essential too. So we do overnight caring center, which is a 24/7 support. And we also do in-home. We go into people's homes and we, on a regular basis and make sure that they're okay. We run something called congregate dining, which is a get together. People come together and they play games and they do exercises and they have a nice meal together and they make friends. We had somebody who came who just was grieving the loss of her partner, her husband. And we talked her into coming to our congregate dining, and she came and she made friends. And she has gone on to become very active in our group outings. So she has people that she knows, and I think that's made a huge difference in how she's feeling and coping with the loss of her husband. And we do transportation and grocery delivery services. So I'm going to go into some of the details on those things, but that's sort of the menu of what we do. All right, next slide, please. Okay, everybody wants to know, so how much does it cost? All right, and you absolutely have to know. So I've included our fee schedule there. I want to stress, if you can't pay, we'll find a way. We do income testing, income means testing. So please look at those. So for example, a lot of our programs are no cost, but the overnight caring center is $64 a night, which is all your meals, all your care, all the support you need 24/7. So it's very inexpensive. And I put it to the hospitals. If somebody has to go into hospital because there's nowhere for them to go, it's $2,000. It's more than that. It's hugely expensive for the public health system. We can help people at a much, much better rate. And in a way, it's in a home-like atmosphere, not in a hospital, but in a caring center where it's sort of gentler. So those are our fees. Next slide, please. And this, I know you can't see it very well. I hope you can see it later, but basically this is so it's not mysterious. So somebody says, my wife had a stroke. She's coming out of the hospital. I'm not able to make sure that she can move and wash and all those things. So that's the first, it's a telephone intake. And then one of our case managers, and the case managers all work in one group. So if your needs change, you start out with exercise and wellness, but you now need transportation. The case managers do the coordination. You don't have to worry about anybody being referred. It's done for you. So there's no mystery. But these are the kinds of questions that we ask, or what do they need? So I just wanted to let you know that it's a very high level intake and assessment. And then once this intake and assessment is done, we meet with the family or with the client and we say, what do you think? These are the set of services that we think you may need. Somebody may need a walker. Can we advocate for a walker? Somebody provide a walker. Somebody may need in-home respite. How can we get that paid for? So, and we advocate with the Ministry of Health, who is our main funder, and say, here's Mrs. Jones. She is in the following situation. We believe that she meets all the criteria for financial support for these kinds of programs. Can you please refer her to us and we can get cracking on helping her? Next slide, please. So I'm going to go into more detail about what happens in an adult day programs. They're wonderful programs, actually. Our drivers, we have 7 vans, go out and pick up clients with an escort, and we drive them to our adult day program. So, you have to go to work. We are out there. We will make sure that the client's picked up and carefully delivered to the program, where they get a lovely morning snack, and then they get lunch, and they play games. And it's quite interesting because most of the people have dementia, but they're very able to engage with each other, and they like being together. They like being together in a respectful environment, and they like the exercises, and they like drawing pictures. And we had a ballerina who was coming to our program, and every so often she would stand up and dance. So she hadn't forgotten that she was a ballerina. It was a beautiful thing to see her doing that. So basically, our exercise and fitness folks go in. They also do exercise programs with them. I tried those exercise programs. I was exhausted. So if I was exhausted, just can imagine what these other folks are like. It was very good. It's just gentle, seated exercise, but geared to seniors, geared to delicate and frail people. We have a lot of volunteers who come in and help cook the lunch and serve the lunch, and also engage in any way they can with the clients, to sort of sit with them, read, do whatever they can. Now, during the pandemic, I'm going to just say, when the pandemic hit, every single one of our group programs, including all our adult day programs, had to be suspended. We could not bring people in. So all the staff that were involved in those programs, we shifted them immediately to wellness calls. So if you came to our adult day program 3 times a week, we called you 3 times a week. And it's interesting because the first few weeks people are saying, I'm fine, I don't need any help, I'm okay. By the third week, we kept hearing, we can't get to the grocery store, we don't want to take the bus, and even if we could take the bus, we couldn't carry the groceries. So we set up a mobile food bank program for grocery delivery and hamper delivery, and so we did that. But what we really noticed is that even though it was virtual, we would send packages of activities out to their homes. We would arrange a chicken chalet lunch together. So lunch would be sent to their homes. Everybody would go online. Everyone would eat their lunch. We had Zoom dance parties. We had whatever we could do to try and help people stay connected. That's what we did. And it was very successful. And it really was set. We did art programming, meditation, we did yoga, we did whatever we could think of doing to keep people connected with us. And one particular group, the Daystrom group, they stayed connected as well. So basically, that's what now, as of April 1, I hated to do it because our virtual programs were very successful. We have exercise in Mandarin, for example. We moved all those people back to in programs because after 3 years of being isolated and alone, they needed to get back together in a safe environment. So our programs are now fully operational. We run them in 4 different locations in Etobicoke. I don't know if this sort of thing is available where you are, but that's what our adult day programs are, and they're they're very fun. Next slide, please. Assisted living. So these are 3 seniors apartment buildings where we have staff 24/7. So those staff have the clients. They know that Mrs. Smith needs a security check twice a day. She may need a sandwich. She needs a bath or a shower on Tuesdays and Fridays. She needs help to connect with her family, help with her medication, make sure she gets it, all of those things. So what often happens, and one of the things we're really noticing is after the COVID, so many people were so frail because they hadn't walked, they hadn't been outside. And the number of people who were falling, the incidence of falling, just went through the roof. So one of the biggest challenges we have is we have to make sure that we see our clients. And 90% of the time, if they fall, it's not observed. So they're in their bathroom. They've fallen off their bed. They've fallen off a couch. They're all by themselves. And so our job, in that case, we call 911. They come and help the person up. And if they deem it necessary, they take them to the hospital if the person agrees. So we are in those. We do, personal care, bathing, light homemaking, making sure the garbage is taken out, do their laundry, get them some meals, help them with their meds. We are not allowed to, all we can do is say, here's your meds, please take your meds, because we're not doctors. We're just there to make sure they take their meds on time. And as I said, these services are personalized to the individuals themselves. Not everybody needs everything, but we do monitor and say, okay, we think, this person is perhaps getting weaker and may need some more, like a couple more hours of respite care or more support or whatever we can do. So it's not like once we start, that's it. It's we keep watching to see what else you need. Next slide. caregiver support, I mentioned this, is that so many of our caregivers are out there looking after their loved ones, and they're all alone. And so we bring them together. They can either come virtually, and anyone here would be, if you're a caregiver would like to join this group, of course, you'd be welcome. And or you can attend in person. We offer them both in person and virtually. So some people can get there, some can't. And really, it's an opportunity for those folks to get together and talk. But we also bring in special speakers. We did massage for one of them. We do grief counseling or how to deal with grief. We have a lot of special speakers that come in that we think caregivers really need the kind of support. So that's right now it's every second Wednesday of the month, but we could do it more often if we have more folks that want to do caregiver support. Next slide, please. Am I going too fast? Okay. Okay, and this is our health and wellness programming. I just don't want to talk like a motor mouth here. Anyway, wellness and fitness. It's free. We have a telephone and in-person group exercise and falls prevention classes. We did a huge outreach on falls prevention. We go to all of the assisted living buildings wherever we can and help people get the exercise and the strength not to fall. Because falling is deadly. It's really terrible. Our classes are led by kinesiologists and qualified kinesiologists, so they know what they're doing. They're all designed to increase balance, strength, and flexibility, and build self-esteem and maintain independence. Yes, I'm okay. I can walk to my house. I'm safe. I can go into my garden. I'm not going to fall. We want people to feel independent and have the strength that they need to stay in their homes and live well there. As I said, respite in-home services. Okay, as respite, of course, is for caregivers. So this is where we send in our staff who go right into the person's home so that the caregiver can go out and take a break or whatever they need to do. And they know that they're in the care of someone who's very good at what they do, PSWs. Our personal support workers have been with us quite often for 20 years. Like they're just amazing people. And so we know them very well. So they go in and they provide personal care, again, light homemaking, meal prep, medication assistance, companionship. There's nothing like having someone sit down with a cup of tea and say, how are you doing? Just to talk, just to be with someone. So, and we also escort them to appointments. So if, for example, they need to go to a doctor's appointment or whatever, we can arrange the transportation. We would also, you would also be able, we'd have an escort with them. So, because they can't maybe go safely by themselves. Next. This is our prize program. So what we do is we offer a very unique 24/7 caring center. We have 2 locations. These centers are staffed 24/7. So let's say you're coming out of the hospital, you've had hip surgery, you're going home to an empty house. There's no way you could possibly cook or help yourself wash or whatever you need, you're going to need help. So up to 40 days, people can book into our caring center and they can stay with us. We can't have people stay more than 40 days. They must have a destination. Either that's in 40 days, I'm going to be able to go home, I'll be well enough. Because we're not what they call alternative level of care. And we know the hospitals are desperate to get people out. But these beds are very specifically for people who need short-term support and care out of the hospital. So that's what it is. This one that you see here is our more homey one. It has a little balcony, 2 bedrooms. Everybody has their own bedroom, their own TV, and the PSWs support them with all kinds of things, make them feel safe and secure. And we also provide them snacks and meals. And during the day, Is there a waiting list for this respite centers? I tell you, I just spoke to the manager and she said, I've got it down from 240 to 35. So no, I don't think so. At this point, if you're interested, just please do an intake. Call them and say, I'm interested in learning more about it, even if it isn't for you, that you think somebody that you know may need this, and help them connect with us. And let's get them assessed and evaluated and get them eligible so they can come into our caring center. So this one is a 2-bedroom, as I said, staff 24/7 with all the help they need. The next slide, please. This is our new caring center. We are very proud of it. It has 8 beds. It also has, we also run our adult day program out of this center. You see the green paint, nobody liked it. I liked it. The green paint I chose for our adult day program because they said, find something that makes people alive and active, and green makes them active. My poor staff said, you're giving us a headache. It's terrible. However, they seem to have come to terms with it and it's very successful. The showers, we've got all accessible showers. We have a state-of-the-art kitchen. We have a lovely dining room where people come. And so if you're coming into our caring center, let's say you book in and you're there at 2, okay, you stay overnight. The next day, we make sure that if you want to, you go to an adult day program. You're not sitting in your room all day. If you want to, you join an adult day program. We'll take you to one. It's either there at the caring center or we'll take you to one of our other caring centers so that you get that socialization activation. It's nothing worse than just being in your bedroom all by yourself, you know, feeling pretty lousy to begin with. So that's our, oh, and there's a virtual tour of this caring center on our website, should you wish. But, you know, if any of you wanted to do a real live tour, you can already tell I love showing off. So please let me show it off to you. Come and see it, and we'll take you through and give you a chance to see what's there. And also you could see what goes on in adult day programs. So happy to do that anytime. Next. Okay. This is somewhat of a sad story and a good story. So when COVID hit, as I said, we found that many people were not able to get food. So we worked out a deal with the Daily Bread Food Bank and with North York Harvest. And they donated food for us. And we set up a mobile food bank where our staff packed the boxes and working with community health centers and others, because they know where people are hungry, working with Toronto Community Housing Corporation, they know where people are food insecure. And we delivered thousands of hampers to those folks during COVID. Unfortunately, this is a heartbreaking story. We couldn't find funding to sustain the mobile food bank as of April 1 because we were using our vehicles, our transportation vehicles that weren't otherwise used, but we were told you can't do that anymore. So I may have a line on money for that to get that going again. I maintain that mobile food bank is in suspension. It will come back. So we're thinking we may be able to get some funding to bring that back and to work with other agencies. We need to know who's hungry because we have the wheels. We can get things to people. We can get food to them, but we don't know who needs the food. We also do group outings. We're planning a bunch of group outings, things like Philharmonic, going to the Philharmonic. Why not go and do a fall colors tour? Why not go and look at Christmas lights? Why not go down to Sugar Beach? Why not go to the St. Lawrence Market? Group outings, we can take 9 people in a van. Would love to arrange that for you. And so I'm working very hard to get group outings. So if you're interested in group outings, please let me know what kinds of things would you like to see and go. And I'm assuming that some of you are in the Toronto area and we could actually help you. I apologize if you're not in our area. Now, the other thing we did was, despite the fact we closed our mobile food bank, we knew that many of the seniors we were providing food to. could not get out of their apartments, were not going to be able to get food. So we kept that going. So what happens is they call us on Friday and say, I need eggs, bread, cheese, whatever. We place the order with a local No Frills. No Frills packs the bag. Our staff go over and pick up the bags and drop the groceries at their doorstep. We don't really charge, we only charge, I think, $2 for the transportation, but if $2 is too much, we don't charge. And at the end of the month, they pay their whatever they bought for their groceries. That's part of their billing. Again, if they can't pay, we're not going to stop. So we're actually, that program, I can see it, it's getting bigger because more people are isolated and alone. And if you don't come to the door and pick up your groceries, we're coming back. We then say, what's happened with Mrs. Jones? Where is she? Is she okay? Check in on her. Because part of this is a security check. Just make sure people are okay. Next slide, please. So these are new and unique programs. Remember, I mentioned to you that there's a disconnect between the primary and acute providers and community sports services. It's because we work in two different universes. But this is a wonderful new program, which we're doing with Home and Community Care, Ontario Health, Dorothy Lay Palliative Care Hospice, Humber River Hospital, and us. And what this means is if someone is deemed palliative within the next year, that person is sent to hospice at home. One client, all 4 agencies wrap around. So that client doesn't need to worry about it. We then take it from there. We say, okay, what supports do they need? Do we need to send physicians into their home? Do we need to send respite care? What do we need? And so rather than having to go to 4 different places, their name is referred to us, and then our job as a group is to look after those people from throughout their last year, their journey. All of these agencies are marvelous, great partners for us. And you know what typically happens when people are ill is they end up going to emergency, going back to emergency, going back to emergency, and they end up dying in hospital, which they don't want. They want to be in their homes. They want to be able to stay as long as possible in their homes. So this is a very interesting, it's new, and what it does is it connects all of us together under one umbrella so that the patient doesn't have to worry about what's going to happen next. We work with them to make sure that those supports are provided to them. So that's new and unique, and we're going to be starting to intake patients in December. It's a 1-year pilot. We'll probably serve 25 to 35 clients. It's very intense work, but we think it's absolutely essential work that we be doing this. Next slide, please. Hearts. I love the Hearts program. So this is funded by the Alan Slate Foundation. It occurred to us that there's a lot of seniors out there taking care of their adults, children with disabilities. And I heard a story of one gentleman's 85. His daughter, developmentally delayed, could not go to sleep unless he sang to her. So he would call her every night and sing to her. It was excruciating for him to think, what can I do to prepare, to make sure she has the support she needs, the advanced care planning. So it's that we work with the seniors. We also have just started psychotherapy with some of those seniors who need more than just workshops. They need to talk to somebody about what they're going through and the worries that they have, because it's a terribly worrying time if you've got an adult child with disabilities. And so our partners are Humber College, York Central Community Living, and ESS. And this program has been so successful. And, you know, no matter where you live in the country, This program is available virtually. And I just think of all those people in your faith community, you may know, this person has an adult with disability. They could use some help. There's no reason in the world why they couldn't join virtually and get the help they need or join the conferences. Things like advanced care planning, wills and estates, those kinds of things. So if anybody may need this kind of very specialized support, please reach out to me and I'll make sure that I connect you with the group that's doing this program. Next slide, please. Oh, that's me. Oh, okay. So that's it. I've done a lot of talking. I wanted to say, though, before we just do this, is this might be a good time, if you feel like it, to sort of, first of all, I'd like to know from you, what are we missing? What other supports should we be putting in place? And that would be one thing, because I'm being very selfish. I want to know what is needed out there. So that would be good to hear from you. Also, what's available in your area? And so that, you may live near others that have, that there's transportation, that there's whatever is out there, so that you have a chance to share with each other about your experiences and what you found and that sort of thing. And I think after all, if there is any way, one of the things we know is we do not serve newcomers and refugees. And we don't do it well because we don't speak the languages. And this is our strategic plan, this is our top priority. We have so many people coming from outside the country to live in our community, some of whom are coming from communities where there'd be no such thing as community support services. They might not even know there was such a thing here, so what can we do to find a way to expand our support to people who otherwise might not even know that we're here? So I've talked a lot.
Hi. Hi, Alison.
Yes.
You are God sent.
Oh, thank you.
Let me tell you, it was an excellent, I won't say presentation, information and knowledge that we got.
Great.
A lot of people have been asking questions. I have asked them to ask you, but one question that kept on coming, emerging again and again and again is, are these kind of services available in the West, like Mississauga, Oakville, Brampton?
Yes, they are. Not from us necessarily, but if you were to call us and tell us where you are, what we would do immediately is we'd refer you to Peel Senior Link or Canes or some of the other agencies or chats. There are other agencies out there, but rather than trying to find it yourself, call us, tell us where you live.
Wonderful.
And then what we'll do is we'll make the referral and say, here's who you should call. And honestly, if you don't get satisfaction, call us back and we'll yell at them.
Okay. This is great. I must applaud you for that kind of an offer. I am sure you are getting so many calls already and you are adding to that workload. But that shows your commitment to this service, Alison. We love it. I'm sure my group here would voice the same thing. Look, I see in the chat. Can you see the chat? People have
yes.
They are so happy, and I am very grateful to you for agreeing to be with us in this group.
Great pleasure.
And I must tell you, if there's anything else that you come across in the future, or maybe anybody, this group will always be there to get that knowledge and information from you.
That would be wonderful. And can I bother you over time to get some advice from your group on languages and connecting with newcomer and immigrant communities? Because we're not good at it.
Mm.
And we need to get better at this. Just think of all of the people from Afghanistan and from Syria and who are here now. And I'm just thinking honestly, but so it's not enough to say, isn't that terrible? It's really important for us to say, so what do we do? And maybe we don't do it alone. Maybe we find 4 or 5 other agencies and we say, okay, this is a problem we all have. How do we fix this? How do we sort this out? Yeah.
So there are people, Azmina, I see your hand up. Can you just ask question directly? I will be
Yeah.
happy. Yeah.
Thank you, Alison. This was amazing. And this will be so useful for us because a lot of community members in our community come and ask for help, and now we know where to go. My one question is the overnight respite care.
Yes.
It's about $60 some a night.
Yes.
And you said they can use it for about for 40 days before
Up
they
to 40 days.
Yes.
Yes.
Now, is this covered by any chance by OHIP or by government?
Okay, so here's in fact, it's subsidized. I think the actual cost is $450 a day. So it's covered most of it, but don't let that stop you. Because if people need overnight care, short-term respite, that's why we raise money. So what we don't want to do is say you can't come because you can't afford it. But, so I would say 85% of it is covered by the Ministry of Health. We're funded for it. It's just that last $65 that we're not covered because we actually have a big staff ratio. We have at least 2 to 4 clients. So there's always 2 people looking after 4 clients. So but please just phone the intake line or connect with me. I'll put you in touch with the people who are involved in that program. And oh, by the way, we love volunteers. Anybody want to volunteer? We would love to have you volunteer. So think about it.
Yeah, as soon as I retire, I will contact you. Thank you.
Pleasure.
I'm sure you know what our community is very well known for their voluntary spirit. I am sure you are aware of it because the moment, let me inform the group, the moment I told her that this is from the Aga Khan community, she just jumped at it. She knows the Aga Khan community very well. All the participants in this group are, I would say 99% of them are from this community.
Wonderful.
So I'm sure some of them will certainly come up to offer services. Even I felt like when I was listening to this. Gulshan, you have to be unmute here and unmute yourself. Yeah, talk.
Okay. I am not amazed. I am just blessed to listen because I'm in Calgary. We don't have anything of that sort. And I was in the midst of going through different retirement homes, but I can't afford $4,000.
Oh.
And more, that's the minimum, $4,600 for the studio. And nothing, no help except the food is provided. So when I'm listening to all this, I feel like moving to Ontario. But no, you did so well. Every slide I wrote down, but I wasn't fast enough. But I wanted to congratulate you, Mumtaz, for arranging this with Alison. And Alison, bravo, because you really opened my eyes. Okay, thank you.
Thank you. And by the way, Mumtaz has the slide presentation, and I would encourage her to share it with you. It has my personal cell and my email, and don't hesitate. I've had wonderful jobs in my life. My first wonderful job was running a youth shelter, but I got to tell you, working with seniors is more fun. I had no idea how much fun it would be to work with seniors. My gosh. Just great.
Thank you. Now, do we have anything in Alberta on the west side? No.
This is the problem. I don't know. And I tried to connect with our OCSA. Here's the, I will look. The trouble is every province will be different. Some will incorporate some of this in their seniors ministry funding.
Yes. Okay.
Some will be, you know, I just, how active is your United Way in Alberta, Calgary, Alberta? Is it pretty
Oh,
active?
It's active, but I haven't been involved with them at all. I should take initiative into that.
Well, no, I'm just saying that they may, because you see, they fund a lot of nonprofits. And I think if you said to them, who do you fund in Calgary that provides senior support services?
Provide
Because
senior, yeah, senior
no,
support.
start with them. I can't think of, because if you try with the government, you're going to get the one person who's not on the line and never comes back to answer your question.
Okay,
Just
so what is
being
the
rude.
group you just mentioned? What is the
The
United Way?
United Way. The United Way. So in fact, I think the funding we're going to get to reopen our mobile food bank is from United Way. They are very active. They fund a lot of, well, they fund nonprofits. So they might be a good way to start. Just say, I just want to know, is there transportation? Is there food support? Can I get help? Where can I get it?
Okay, no, excellent. All the slides, I should reach out to them and I'll tell Mumtaz to send me. And then I will also tell in my community how we can reach out, right?
And don't hesitate, call me. You know, I'm
Okay.
quite happy. I know it's expensive. Or send me,
I
you
can
want
email you.
You can email me, we
And
can
what's
send a
up?
Teams invite.
Your
Cost me
name is
nothing to
there,
do
right?
that.
Mumtaz
Yeah.
should be able to give me
Yeah.
your phone
Yeah.
number.
We have already sent you the slide deck with the last email that came today, this morning. It was sent to you with the slide deck, which
Okay,
has
it's there.
total information there. It is attached to the email. Just open and check it. And if you don't find it, or if you are not registered with us, then you can send us an email, and my personal email of the company will be put up now by Zool. So you can ask us and we will send it to you for sure.
Okay. Thank you so much.
Welcome. It's our pleasure. And I would look forward to you putting me in touch with other people that you come across like this,
Sure.
and we can share it with the whole group, right?
Yes, share it widely. Honestly, that's for me. I basically say, you fund us to provide community care support services. Help us inform people about it. You know, because that's the problem. Public education, people just don't know.
Yeah. Communication is a must for
The key, yeah.
It is.
Tazim, unmute yourself and talk. You have a question.
I have a comment. Mumtaz, thank you very much. Really appreciated the chat. I'm in the middle of travel, so I won't put my photo up. Alison, I chair a women's group in the West, in Etobicoke. We have women, we have about 100 women, 150 women who come from Mississauga, Etobicoke, and Greater Toronto.
Yes.
And we would love for you to come and share.
I would love that.
Plus, also, we support food banks and women's shelters, giving them all the support we need as much as we can.
Wonderful.
We get donations from our memberships. And so we would love to help you as well. We have a team of 7 that volunteers that are core members who serve this community. And I would like you to come and talk to us first.
Anytime.
And then talk to the group. And we will set up everything for you. Are you in Etobicoke?
I actually live at Yonge and Eglinton.
Perfect. Okay.
But
So
I can go anywhere.
Yeah,
So don't worry about it.
It's easy enough. It's off the highway, so you can come to us to speak to us. But what I'll do is set up a Zoom meeting with our core team and yourself. And Mumtaz, I really, really appreciate your connection with Alison. I think our community will benefit, will be reciprocated, because our community is very multicultural. And we have a lot of volunteers who are happy to help. And I have a sister right now going through a lot of trauma and a lot of pain. She's in assisted living, not able to get the support she needs. So I will definitely call you. And this has been superly helpful. And we appreciate your time, Alison, and we really, really wish you all the best.
It was an honor. Thank you very much.
Your commitment to this work, Alison, exudes out of your expression and your face. I'm telling you, it's really inspiring us,
Empowering, yeah, empowering.
empowering as well. And somebody is asking here, of course, Zul has put in the email where you can send direct email to us, to me,
Yeah.
and answer, send you the slide deck if you haven't received it, if you are not on our distribution list. Please go
Yes.
through the chat and take down the email. And I think there was someone else who was asking something. Yeah, somebody asked that Noor asked, no, not Noor, Salima asked. Salima, you want to put the question yourself? Okay, she's asking, do you assist helping seniors find an affordable place to live?
I wish I could say yes. We don't do that. And I know that there is a group in Etobicoke that are looking at housing and homelessness, but it's just with everything else we're doing. I don't know what we're going to do.
Yeah.
Because 60% of the population. By the way, Mumtaz, I'm doing this selfishly because I'm 73. I need these services. This is purely selfish. I'm doing this for me. So yeah.
But to tell you the truth, you won't need these services for next 15, 17 years. The way you are happy with the work that you are doing, Alison, you know more than me. This will keep you healthy and going maybe till the last breath. Amen.
Yes, indeed.
Amen.
That's it. All right.
Shall we don't feel like telling goodbye to you for the time being. I really think
This is amazing.
Yeah.
Thank you.
Dolly,
Thank you.
Dolly, you have a question? Who is funding these services? I think she mentioned United Way, but something more as well. There
Okay. Yes. The services that we provide, about 68% is funded by the Ministry of Health.
Oh.
But it comes through what they call home and community care, which is a, oh, it's all very complicated with the whatever. But anyway, so they in fact fund home and community care, and it's those funds. So if somebody's coming to us and needs assisted living support, we make the case that they're eligible for funding through community home and home care. And so then they allocate the fund to us and they allow us to spend money. That's why if we can get it for free, we will, because most seniors can't afford anything extra. Other than that, we hustle. We're out there taking money from everywhere. United Way, Trillium Foundation. We just got a grant from the Retired Teachers Association, and but you're constantly competing with so many other people. And nonprofits are having a really hard time, as you probably are aware. That there's a very interesting report about nonprofits' health, their financial health. They say about 2/3 of them are unsustainable. What is going to happen?
Yeah, it's a lot of effort to keep the good work going.
Mm-hmm.
People have succeeded at it, and it's a cycle now, right? Because you have succeeded it, you continue doing it, and it works for everyone.
There you go. There you go.
Listen, thanks a ton for sharing.
Thank you all for your lovely time and questions and attention. Have a lovely weekend. Okay.
You as well.
Much. And if you know of anybody else who would love to share with our group, we are here to share it with them. Okay.
Okay.
Thanks a ton to everybody, all my group people, and Alison, again, once again, I will never get tired of thanking you.
Okay. Thank you so much. Take care, everyone.
All the best. Bye for now.
Bye. Thank you.
Thank you, Alison and Mumtaz. This was a beautiful and very informative program.
Thank you.
Really enjoyed.
Thanks for all of you to be available here and inspiring us to do this work. Thank you.
Yes, thank you. So enlightening, honestly. Mumtaz,
Yeah.
do I have your number? It should be there, right?
Yeah, it is there in the slide deck. Alison's number, contact, everything is there. Last slide is that, okay? And in
Okay.
case you haven't received it for whatever reasons, you can actually get back to us, okay?
No, I got that contact. All right. That's
Yeah.
it.